Doing all right.
Yeah.
Um, I shared some of your story in that last update, video update. Oh, one more thing before we get going, y'all. I love the comments that everybody puts out and the questions they put out, but we kind of keep them to a minimum right now because it's going to be difficult for me to keep up while I'm talking to Tammy while we're talking. We're going to take frequent breaks so we can stop and answer questions, and then we'll have a big question and answer at the end. Okay. So Tammy, you're in Ohio, right? Is that right?
Yes, I am in Ohio. If anybody else is in Ohio, I am close to Serpent Mound.
Awesome. And before we get to what I teased in that video with a heart attack and everything, about how old were you when you started having pain, and is there illness involved too? Is there just a pain issue? What's going on
Um,
with that?
I had rented a 2-story duplex, and when I was 25, I was going down to the basement, and the second step broke, and I ended up tumbling down 15 steps.
Wow. So that's where it started.
And that's where it started.
And was it pain all over, or your legs, your hips, or?
At that point, it was just my lower back.
Okay.
And I went through physical therapy and all that. And they said if I ever lost my back muscles, I was going to be in trouble. And that's pretty much what kicked off the arthritis.
Okay.
So up until I was 31, I pretty much did okay. You know, I'd be stiff at times. There's a lightning bug. And I got pregnant with my son. And after I had him, I thought it was from where he was a preemie, and I ended up with an epidural because they thought they was going to have to do an emergency C-section.
Right.
So after I had him, I had a lot of increased pain. And after about a year, I finally got into the doctor, and they did my first MRI and found out that at that point I had bone spurs. My 3, 4, and 5 was bulging, and
Three, four, five, and thoracic and low back, neck.
just in low back at that time.
Okay. Lumbar. Okay.
So, kind of I was off and on medication, especially in the wintertime. That was my downfall.
Mm-hmm.
And then in summertime, because I didn't really want to be taking anything. So,
Like a lot of us, right?
yeah. So, in 2012, a different doctor that I had started seeing did my next MRI, and the alkylospondylitis spondylothesis, I can never say that word.
What's that mean in English?
Basically where it's a lot of bone pain, muscle. Imagine Dragons lead singer has it.
Oh, wow. Okay.
So, and
Okay.
he's a big advocate for it.
Okay.
And she told me then to file for disability. I refused. Had a house fire. Ended up going back to work and started doing housekeeping of all things. So I kept going. And I noticed that in my hips, I started, when I'd walk, it literally felt like I was a wishbone being pulled into.
Wow.
So I got into, fired my family doctor basically, because he wouldn't even give me the relaxers back.
Right.
And I'm like, I'm trying to work here. This isn't working. And at that point, I hadn't had medication in probably 3.5 years, if not 4.
Wow.
So ended up, I was at work, couldn't take it, went to the ER, and he come back and he said, you need to go see an orthopedic surgeon. He goes, because I can tell you right now, you got sacroiliac joint dysfunction. And so the cushion in between my femur bone and my hip bone on both sides was basically wearing away.
Wow.
And fast forward to October of 2017, I finally broke down and got into pain management.
Mm-hmm.
And I hadn't had an updated MRI in 10 years. We fought with the insurance company. And like many other people, I had to start with the injections.
Right. And did they
And
do? I'm guessing they didn't do anything for you.
for my lower back, I have probably had 8 different sets of injections, and not one of them's helped.
Wow.
Now, in my hips, they do help,
Okay.
but it just got to the point I got tired of being stuck.
Stuck. Tammy, I'm gonna have you pause for a second.
Uh huh.
I need for you to find some light
Okay.
because it's getting dark.
Yep, I was wondering about that. Let me grab.
The injections can make it worse, Amanda. You're right, and especially when they inject
Oh, let me get my
in the
chair.
wrong spot, and yeah, it can be really bad.
All right, this should work.
That's much better. Thank you.
Okay.
So they've been doing injections. I'm getting, you were finding the insurance company for the MRI. I'm guessing they finally gave in and let you get that MRI.
They did.
Correct?
Yep.
Okay.
So the pain management doctor that I had, the first one, he was really amazing. So he actually prescribed, they were 5s. And in this practice, there is several different doctors and PAs and nurse practitioners. But while he was there, I would lucked out and strictly had him.
Right.
And went through, got the updated MRIs. Just kind of took it step by
So
step.
step by step.
And
So how long? I'm sorry.
Go ahead.
I was going to say. So you've been dealing with the leg and the hip pains, and they do injections, and some of those help and some don't, and you're able to at least get some some relief by pills, right?
Yeah.
Before the thoracic episode, did you have problems with them wanting to taper you off or telling you no more, or you couldn't get XYZ if you didn't do more injections? Or
So from up until last March, I was with this same pain management. And for the last 3 years, I had one specific PA. They started having neck problems. And I'll just run down this real quick because this was my last diagnosis with them. So in my neck, I have C3, 4, and 5 that is bulging. I have moderate stenosis. I have bone spurs. And there is a nerve in there somewhere that causes me to have the pain and tingling. It's not diabetic neuropathy, but down into my fingertips. My thoracic area, I had been told years ago that I had scoliosis in it. And nobody still to this day has checked it. I've seen on the MR or the recent X-rays where it curves at the top and the bottom, and the lady's like, "You have to have that checked out." So then, in my lower spine, I have 4 and 5 that has already organically fused together. I have moderate stenosis. So I have 4, 5, and 6. That is bulging. I have the bone spurs there as well. Let's see. I also have an abnormal blood vessel down in the sacral area that will shrink and grow. And when it does this, my legs go numb.
Wow.
So, and then it goes down into both hips with the sacroiliac joint dysfunction.
Wow.
So
you're dealing with all that, and I'm going to kind of jump forward a little bit, and then we can go fill back in. Okay. You're dealing with all that, and then like a lot of us, new pain develops that we don't know what it's like. Holy cow, what's this? This is new. I haven't experienced this before. And you go to the doc or the PA that's been seeing you, and you bring it up. It's like, hey.
Well, I'm going to stop you real quick because there's.
Okay.
I'm going to back up just real quick.
Okay.
So I had been at this pain management all this time. Went, picked up my medication on the date I was supposed to pick it up every 30 days. So my following appointment, I go in, take what I'm supposed to, and I have never failed anything. There was only 2 other times I was either 1 or 2 off. One, I fell and broke my toes. So she's like, I totally understand why you're a couple off, because it was over the weekend.
Right.
And the other one, I was like, I just took one before I came in here on schedule. So you're saying I'm short one. I'm not actually short. I literally just took it in the car. And she's like, okay. So other than that, I'd never had a problem. So the nurse comes in, she does her little thing, counts. Next thing I know, she comes in and starts yelling at me. And I am floored. I am like, what in the world is going on? And she's like, you're over, you're not taking them right. And I'm like, I mentally shut down and started crying before I even walked out. And she gave me one last prescription and dismissed me.
Wow.
For being over when I wasn't over. So I had a friend. I was so upset, and she drove me up, and we pulled where the pharmacy filled them when I picked them up. The pharmacy filled my prescription on the 19th when they shouldn't have filled it until the 23rd. So it sat there all those days.
And that's what threw it off.
And it threw it off.
You and I talked about that this morning, and about the sudden change in that person, the PA or the doctors or the nurses' attitude. And I firmly believe it wasn't anything you did. I think it's more of that practice or that doctor or that nurse is in trouble or catching grief from somebody above them. It's rolling downhill saying you got to stop writing as many scripts. And that's what they do. That's just my opinion, but I'm a real conspiracy theorist when it comes to some of these doctors and some of the practices they do, because It doesn't make any sense. It doesn't make any sense, that kind of attitude change. And eventually you're going to, Tammy, you're going to have to find a more light source too.
Yeah,
So,
I just seen that. I'm going to have to bear with me a minute. I'm going to go
you're
back
fine.
inside, but hopefully the dogs don't start barking. That's why I decided to come outside.
If they do, I'll sick my dogs on them.
We'll have a bark fest.
We will. All of mine. I got one of mine on Xanax right now, so he's probably the chillest one that I've ever had. So, but we'll see. Everybody's human. Everybody understands dogs. A lot of us have the mongrels, have the pups, and can't live without them. So they've cut you off and they give you the one script, right? Are you with another pain management doctor now, or when you went to discover when you started having a thoracic, or what's going on?
So I had mentioned to her before she started yelling, I was like, I got a new symptom, and that was basically all I got out of her.
Okay.
I never wanted to crawl underneath a rock and disappear so bad in my life. I mean, for 3 years, she'd ask about my grandkids, my animals. I thought I had somebody that really understood.
Yeah.
So, and it hurt. On a personal level, I was devastated.
Right. It's just another unfortunate example of the trauma that doctors or medical staff can cause, and they don't even realize they're doing it.
Yeah.
So, you're at a new place. I'm guessing is where all the stuff when the thoracic started, or
yeah, it was with having basically the scoliosis without it being investigated. I just kind of played it off as it was that.
Mm-hmm.
So it took me 2.5 months to get in with a new pain doctor because I literally live in the middle of nowhere. You blink and you miss it.
Right.
And I got in to see him, and I took my previous bottle and the bottle before and the printout. And when he asked me, he's like, "Why did you leave your other practice?" And I'm like, "Actually, doc, I didn't. I was dismissed, but if you'll allow me to explain." And he did. And he agreed to take me on as a pain patient, but he cut me in half.
Right.
And
which is a common thing, right? I was talking with somebody the other day that they went to a new pain doctor, and they thought it was going okay. And the doc admitted, "I haven't had a chance to go through your records yet, but I'm cutting your script in half." And with no justification, couldn't say why, and they couldn't explain why because they hadn't even read the person's file yet. But that was their first step, right? That which makes no sense. They have no medical reason to back it up, but they do that, So he's cut you. So if he cut you down and you're kind of stuck, you got to take it because you need something, right?
yeah. And within those 3 months, my life went to hell in a handbasket. It just, before, I was working because of the virus. They dissolved my position, and I actually ended up going to work at a dog rescue. And during the last 2.5 years of the previous one, I was like, please keep me working. I felt I had a purpose and loved working with the dogs. It was physical. Probably shouldn't have been doing it, but I lost 70 pounds. I was able to move. Not saying that I still wasn't in pain, because even with medication, I still hurt. And, I'd walk through the door, my son would have food fixed, and I'm on the couch.
Right.
So, but it's like, I felt needed and appreciated. So, new pain doc, he's like, let's get you some new x-rays and we'll get you another MRI. And I'm like, yeah, because I really need a complete spine one now at this point. I had officially stopped working in February. And I stopped working February of last year officially. March, April, May. And I seen him at the beginning of June. So I'm coming up, I hit my year mark with being where I'm at.
Okay.
So, as everybody knows, they require physical therapy now. We're going to get into the good stuff.
But you told me that physical therapy wasn't out. They were refusing it at the physical therapy place because your blood pressure was so out of whack,
Exactly.
right?
Most doctors will say, I got my dog on me. Scrappy, lay down, baby. Most doctors is like, at least in my experience, will try to tell you that pain medication will increase your blood pressure and da 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 da. And physical therapy was an hour drive for me because he wanted me to go to this specific one that he had access to.
Because typical, right?
So I would go for my appointment. They take my blood pressure, and it's like 170, 180 over 123. My pulse is 103. And they're like, Tammy, we cannot work on you with it being that high. And I'm like, he's like, we'll sit here for a little bit. And I'm like, I'm telling you, I'm about ready to pull my hair out because I'm hurting. This is what happens. The other pain management let me do what I could of physical therapy here at the house. I had to document. I didn't have that option this round.
Right.
So this went on for about 6 weeks. And finally, I'm like, one, I can't afford to keep driving this. Two, it's not benefiting anybody. So my next appointment rolled around, and this is 2 appointments. I'm like, they are refusing to work on me. My thoracic area, I am still hurting. But he wanted to focus on my hips and my lower spine. I'm guessing because I did get relief with the hip injections, so that was something. But that wasn't the main area of my pain at this time. It's like my thoracic area at times felt like I had been kicked.
Right.
And I'm like, this isn't my normal, I'm on half of what I was. So yes, I'm going to feel more. But I got a feeling here, something's not right. So my last physical therapist appointment with that one, they sent me to the ER. My blood pressure, they're like, is that high? They're like, and I'm like, okay, I'll go. What are you going to do? And I'm like, I'm an hour away from home. Can I at least drive myself so when I'm dismissed, I have my car? So they agreed. They called and checked on me, got in there.
Right.
Did a chest x-ray, didn't even do an EKG. Said, go to your primary doc, you need to be put on blood pressure medicine. And ironically, my family doc had already put me on a blood pressure medicine. because he knew. I'm like, I'm cut in half. I'm not functioning. It's been, couple 2 or 3 months now. I don't know what's going on in my thoracic area. So I got really tired of being gaslit.
So you told him that your thoracic is bothering you, and can we start addressing that? And what he decided to do though was to stick with the area he knew that was working, and it didn't, and temporarily put off the thoracic, right?
Right.
And when you told me that a long time ago, that really hit home with me, because the current guy I'm trying to leave has done the exact same thing to me. I've told him specific areas that hurt and hurt like hell, and he's like, we'll get to that eventually. Let's address this first, right?
Yep.
So so nothing was treated with new thoracic. It was, but nothing. And
I still don't know to this day. I know I have dextroscoliosis. I have no idea what the curvature is. It has still not.
so he's told you we're going to stick with the hips, and one night you're at home, you go to bed in pain because you're not getting the right meds, right? You've been going without the right meds or treatment, right? Maybe the physical therapy could have worked, but without getting the pain under control and the other issues under control, you couldn't even do the physical therapy.
Well,
So
I actually went to the physical therapy place here in town, and I'd been there years ago. And I went in, I said, just give me the referral there. And I made the comment, I know they don't check blood pressure.
right.
I was so bound and determined to get this MRI that I needed that I just kept pushing myself. So I started physical therapy there. I told him what my blood pressure was shooting up.
Right.
And I made a comment to one of my friends. I said, watch me have a heart attack over all this.
Which you ended up having.
Sure did.
Which you ended up having. And y'all, I'm going to tell part of your story for you, because this hits home to me. I live in the boonies. Right? The town closest to me is 10 to 15 miles away. Doesn't even have a yellow flashing light. So instead of EMS showing up at your house when you're in process of having a major heart attack, you have to drive yourself to the ER.
Yep.
Because it would have taken too long for EMS to get there, to get you in the thing, check you in, and then get you there, because the ER wanted you there right away. So you ended up driving yourself to the ER for that, right? And that's crazy, number one. But that's the price that we pay. I guess we live in the country, right?
Yeah. I was trying to get my chicken coop ready for winter, and I knew I didn't feel good, and I got into my family doc on Tuesday, and they did the little EKG, and not 12 lead or anything, and he's like, I want you to go over to the ER and have some tests and make an appointment with the cardiologist. And I'm like, can I not do it today? Am I at least okay not to do it today? And he's like, yeah, but he goes, I want you to go over. And I was like, well, let me see as soon as I can get in with a cardiologist, I know he pulled some strings, because I called and they had me scheduled for 3 p.m. Friday. So that was Tuesday. Wednesday, I'm back out at the chicken coop. And I noticed I was a little short of breath, but the weather had started cooling off. I didn't really think much about it. I'm dragging tarps, and Thursday rolled around and I just could not. I was just wore out.
Right.
And about 8 o'clock, usually I'm a night owl because I can't get comfortable enough to actually be a normal person and lay down and fall asleep like most of us. I told my son, I said, I'm tired. I'm going to bed. This is like at 8:30 in the evening.
Hmm.
So I went to bed and I'm dreaming. Now, I lost my dad October 1st of 2021 to bone cancer. I'm dreaming and he is literally 6 inches away from my face yelling at me to wake up. And it scared me so bad. I got up. I got about 10 feet from the bed and I'm like, am I having a heart attack? I'm having a heart attack. And I went back and forth for a little bit because my thoracic pain had started traveling around under my arms to my ribs.
Right to the front, right?
Mm-hmm.
And it's crazy. If you have pinched nerves in your thoracic, it can cause that radiculopathy to come across, and it feels like a heart attack.
Come, place.
And it makes it hard to breathe. You know, so it's like, what is this? But you were having full blown.
Yep.
And
from in the chicken coop, I thought, I'm going to jump in the shower real quick and I'll just go over to the ER. And I got in, I got right back out, woke my son up, and I said, I don't want to scare you, but I am 99% sure I'm having a full blown heart attack. I said, go grab me some clean clothes. I said, I'm going to go in the bathroom. I'm going to leave the door open, stay out here, because now I'm starting to get scared.
Right.
And I could hear my dad in my head just going, go, 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 go. And I told him, I said, I'm out of here. I'll call you when I know what's going on. And I jumped in the car. I had my phone ready to hit 911 if needed. And I drove the 25 minutes to our local hospital. And I walked in, and I said, I am 99% sure I'm having a heart attack. Wow. So within 30 minutes, they gave me the nitroglycerin. They slapped the patch of nitro on me. And I will never forget the look of this doctor's face after they did the EKG and stuff. And I looked at him and I said, I'm lucky to be here. And he goes, yes, you are.
Wow.
I found out that my tropine levels were a little under 6,000, and at 7,000, they're off the chart.
And I'm not saying that had your pain doc, how can I say this and be polite? But had he shown interest, or had he listened, right?
Mm-hmm.
I'm not a doctor, and it's not medical advice, but if my patient is claiming severe pain in this area, maybe we need to send her somewhere immediately, or maybe we need to change our area of focus. I mean, I don't think sending you for an MRI next week is going to would have prevented a heart attack, right? Excuse me, because it wouldn't have. But I feel there could have been other things that could have been done, you know. But it's just a sign. It's a sign to me of something that I think we all have experienced. Hey, Mike, is that they're not listening to us when we say we have an issue. And y'all, I apologize for the bugs. I live in the country, but they're going to get a little loud. And that's just one of the things that, like I keep saying, of this invisible illness community, we have so many things in common. And unfortunately for you, it led to a massive heart attack, right?
Yeah.
In your words, they sawed you open, right?
They sure did. They was going to life flight me down to the city, and it was raining, so they kept me stable throughout the night there, and then they finally transported me down, and I went directly onto the ICU floor.
Wow. And again, it couldn't have 100% may not have been preventable, but instead of them listening, or I should say, instead of them hearing, right? One of the two,
Yeah.
because it obviously went in one ear over here or over here, and then it went out the other, and they have their blinders on what they want to do, and it's like, oh, we'll get to that eventually. We'll get to that eventually. And as patients, we have to advocate for ourselves. But that sounds to me like
Oh,
what's the. I'm not. Listen, I'm not dogging you,
wait till
because
the
I'm sure you
next
were.
part.
And it's so infuriating to me that in today's medical society, a lot of doctors don't. You know, and so anyway, I'll get off my soapbox and let you continue for a little bit, and then we're going to
Okay.
start taking some questions from folks. Okay.
All right.
So
So they get me down, and this was on the Friday I was supposed to have had my cardiologist appointment. They get me to the ICU floor and do all kinds of tests. That's when they come in and informed me I needed open heart double bypass. At first it was triple. They thought they was going to have to do triple. And I was just shocked. I am 51 years old and just had, there's my dog, a major heart attack that I almost checked out on. Like, this
right.
isn't, everybody that I've spoke with is like, wow, you're awful young. And I'm like, you think?
Yeah.
I'm dealing with everything else on top. But so while I'm in the hospital before surgery, I keep telling I had two fabulous male nurses. They were phenomenal. Let me even have a shower before my surgery. They were amazing. So I was seeing this surgeon's assistant, and mainly, and I'm like, hey, look, I am a chronic pain patient. Here is my doctor's card. My medication is not even going to touch this. Can you please call my doctor and find out who is treating my pain after this? I sounded like a flipping broken record, begging people, anybody, I don't care if it was a regular floor nurse, anybody that could help me on who is treating my pain after they cut me open and saw me in two and wire me back together. I'm like, I can't believe this is happening. So the last time I seen this surgeon's assistant, I called her the B word. My
It may
mom
not have helped a lot.
about fell over. And I'm like, look, nobody's helping me. I am a pain patient. I have other issues. That's not even being taken care of. And now they want to do this, and nobody's working with me. I advocated for myself so hard.
I know. I'm not. Trust me. I'm not, sweetheart. I'm not saying that you didn't. I'm not.
Oh, it was,
I'm really not, because I know you would have.
and
You
it's
know.
like, you know, there's nobody else around me that
I mean, like,
could have done this for me other than myself. And
there's a lady that I've met through TikTok. I'm not going to mention her name, but she just had a procedure done that they totally did not do the pain meds during the procedure as promised. And so she's having to work with a hospital advocate. And I've had to work with hospital advocates before, and it's like they know who who writes their paycheck. And it's very difficult to even get a hospital advocate in there, to stand up for ourselves. And I want to touch on, I'm trying to catch the comments, y'all. I really am. We are going to do some questions here, I promise. But I believe it was Kat that had said, had they managed her pain, most likely would have been the huge spike in the blood pressure, right? And that's so true.
I couldn't get him to understand when I can go see my family doc that's 10 minutes away. I can take my medication, go see him, And it might, be low, well, raised a little bit below the low border of when they start like actually watching your blood pressure.
Hmm.
But I'm like, you guys are catching me, 3.5, 4 hours in to half of what I was on. And I just want to pull my hair out, and there's not, my personal experience, pain affects blood pressure.
Mine too. And I would venture to say that we have 49 people here. If they're pain patients, it's 49 people
Hmm.
that would back that up. You know. So they weren't giving you anything for pain when they had you right prepping you for laying in that bed.
Okay, now, while I was in the hospital and I had to fight with it, I'm like, this is normally what I take, this is what I'm on. And while I was in the hospital, they did take care of me while I was there.
All right.
I will
Okay.
give them that. Um,
But there wasn't a coordinated plan for when you left.
the
Nobody sat
surgeon, yeah, after I called the
down.
surgeon's
Yeah.
assistant, that he came in and I handed him my pain card with my doc, all the information. And I'm like, because I always carry a few, just if I ever need them. And I'm like, who is taking care of my pain? She's not saying anything. I can't get anybody to answer me. And, I'm having surgery. You're coming to get me at 5:30 in the morning. Don't worry about it. I'll take care of your pain.
Yeah. And they
Yep.
didn't. So I think I teased it in the video for to tease it. What did they send you home with to help you to take care of your pain?
They shoved me out the door with no instructions other than to let the water hit my back when I took a shower and make sure I had a seat in there. Didn't tell my mom anything. The discharge papers were a joke. And I asked him to hold off on my pain medication for the ride home. I had an hour, almost a 2-hour drive to get home, back to my mom's. I couldn't even come home. So she stops to get my medication, and I'm looking through it. I'm prescribed Tylenol.
That's unbelievable.
They cut me open, sawed me in two, and wired me back together and gave me Tylenol. So that was on Friday because I was in the hospital. I left on the 8th day. They did surgery that Monday, and I was leaving out of there to come home that Friday. They sent me home having pneumonia. Actually, I'm going to back up a little bit because Mom had stopped and got my medication. We got to her house. I got out of the car. I'm thinking, basically, I was having an out of body experience.
Yeah.
I didn't even make it into my mom's house. I dialed 911 and had them come get me. So
Right.
that's when I found out I had pneumonia. And then it was the next day I found out when I went to go take my medication that this doctor had sent me home on Tylenol.
Take a break for a
So,
second. Take a
uh,
break for a second. Take a break for a second.
oh, this is why I am now diagnosed on paper as having medically induced trauma. And it is a diagnosis, just so everybody knows.
Yeah. Get something to drink, because I know it takes a lot out to get it out.
Yeah.
Because while we share these stories, part of our brain and our psyche is reliving what it moments that in our mind. And I want you to take a minute just to kind of take a breath.
The next 3 weeks were just, I ended up back in the emergency room 8 times. Like, am I having another heart attack? What is going on? And they treated me here at the local hospital so good. They had even the Benz car, I guess, the Benz, they had even prescribed those.
Right.
Not a lot, but yeah.
I have questions. I mean, just because I'm inquisitive, but if anybody else has some questions, if you want to start throwing them in, or if you want to join in the conversation, I can pitch up on the screen. I know that Scissortail had put in the comments on the video about some of the procedures her husband had, and there's no way that Tylenol would have had any kind of positive impact, for him. And people are talking. I forget her name. The doctor-patient forum lady did a thing about they're now saying that Claudia said that opioids by the CDC aren't being recommended for kidney stones. Y'all, if you've ever had a kidney stone, you want an opioid. The largest I've had was just over a quarter of an inch, and I would have crawled out of my skin without it,
Yeah.
And it's sick. It's gross how pain patients are being treated. Somebody, I was sharing your story to them, and they said that in some cases after heart surgery that Tylenol is the recommended form of treatment for pain. But then when I was questioning them on it, they're like, but you're right. If they're a pain patient, they know pain already. There has to be some other way to do it, So it's, Shelley, I'm not saying that it's effective after surgery. I'm repeating what these professionals, what these people who write books, and make their living off of. This is what they're saying. It's not my opinion. Trust me. Because it's just not right. It's just not right. And like Kat said, also, the odds of not treating the pain causing the blood pressure spikes. When I'm in intense pain and I go to my doctor and they take my blood pressure, they're always like, "What's going on?" I'm like, "Oh, I'm in a lot of pain today." And they're like, "Oh, well, that explains it." Well, yeah. And for professionals who are supposed to know this stuff not to recognize it, it's crazy. It's crazy. Yeah. I just don't understand it. But yes, Sadie, kidney stones are very, very painful. They really, really are. So I hate that you went through all this, but so much of that stuff that you went through, the doctor not wanting to even acknowledge the pain in your thoracic, the doctor's not sending you home with an adequate plan, Yeah. And it's crazy. It really, really is, how it can be justified and how they go home at night and they sleep well.
That's a good question because I have thought of that. I would like to know.
Because it just doesn't make sense. I don't know how people do that. It doesn't make sense to me. I'm going to kind of scroll through these comments, Cheryl. If you have questions, type them in again because I've missed a whole bunch of stuff that have been going through. Scissortail, you're right. They've lost their humanity. Tammy, while we're sitting here, are you still seeing that pain doctor, the one that cut you and ignored your thoracic?
What happened finally after? Let's see. I got home that Friday. Monday, I called the surgeon, And his reception was like, "Oh, honey, I am so," even she's like, "I am so sorry. Let me send a message back." And I'm like, I can't do this. Somebody, and I'm like, somebody has to do something or I'm going right back to the ER and they can just keep me over here. And I'm like, I I know some people do okay. Some people have issues when it comes to open heart, but when they say that it definitely changes you, it does. And Tuesday I called back and she's like, "I'm going to go back and personally talk to him." So I was on hold. He called me in a week's worth of medication finally to get me to my pain management appointment. Then I called pain management and I'm like, "I'm not going to make my appointment. I just had open heart double bypass." So set up the televisit. I was lucky enough I was able to do that for 2 months. And ironically enough, I ended up back on what was originally working for those 2.5 years.
Well,
And it still was not pleasant. I'm a stomach sleeper. I couldn't sleep on my stomach, couldn't sleep on my side, couldn't put my arms above my head.
right.
And basically, I stayed at my mom's for almost a month before I was even able to come home. Even though my son, he'll be 21 this year, I didn't want the dogs jumping on me. They hadn't seen me. And had I been by myself, there was no way in the world. I don't know what I would have done if had it not been for my mom and my son. My daughter's in Kansas, but and it was just the mental part of all of this, and it was like it just one thing after another just kept leading up until all this happened. So I'm still seeing the same doc. On the 20th, I will be 8 months post-op. So for 3 months, he left me on my original dose at the other pain management, which as I was thankful for. But before my surgeon dismissed me after 2 visits and 6 weeks after open heart, I asked him, I said, "Doc, I got a question," because as I was healing, and I can't lift my arms above my head, but I would move kind of side to side, and I'm like, that pain's gone. And I'd sit there and I spent a lot of time making sure. And I asked him, I said, "Doc, I got a question for you." And I said, before all this, I was having this pain in my thoracic and it went around to my ribs. And then the heart attack, it hit my chest. And I'm like, I don't have it no more. I said, I've got the spine pain, but not that horrible rib pain that I had. And I directly asked him, I said, "Was that my heart?"
Yeah.
He said it was.
It was.
It was.
Tammy, I'm going to see if Scissortail has something she can add to this, because I know that her family experienced heart surgery.
I seen her comment earlier.
Hi, Tammy.
Hi.
Nice to meet you, hon.
Nice to meet you.
I'm curious about something. I want to ask a question. I'm going to give you a little teeny tiny history first. My husband had an aortic aneurysm. And so he had an open heart surgery. It was 8 hours. He had an artificial heart valve. They had to rebuild part of his aorta and wrap it. He was given massive doses of pain medication to get through. Okay. How long after your procedure, after your surgery, did it take you to get back on your feet? And then I'll tell you how long it took my husband, because I'm kind of want to see, I'm very curious to see the comparison.
I'm going to be very honest with you. Being almost 8 months out, it has not been until the last 2 months, we'll say, that I have felt anywhere close to what I was before.
Wow.
For 6 months, it was...
Wow. See, that is the difference, you guys. That is the difference between treating pain and not treating pain. My husband went to Arizona for a huge rocket launch, 4 weeks post-op. His only restriction was don't lift anything because your sternum has to completely heal. And it was, his surgery was huge. This is what we're fighting for, you guys. It is our health. It is our longevity. It is our quality of life. And I feel like they stole 6 months from you that you should have had. And it's not fair. And we have to fix it. We have to fix it.
We have to keep fighting.
How soon did he start how soon was it before he started cardiac rehab?
Well,
Or did he?
He really didn't have to, because he was so driven. He was back at work at 4 weeks too.
Right.
He went out to this rocket launch for a week out in the sun and the heat. And then he was back at work on light duty before the 6 weeks mark. He was so driven. He was just that kind of a man. He was so driven, but he could never have done it without the pain management. There would have been no way. I mean, I spent the night in the hospital with that man for 3 nights. And when his pain wasn't being managed, I was the one at the nurse's desk saying, don't give him this medicine. You need to call the doctor. He needs something stronger because these aren't working.
Right.
And we did that all the way through, and it made every bit of the difference for him. And I'm just, my heart breaks for you, honey. I can't imagine what that was like. I know he had the chest drain and all of the things, and I won't go into that because I know that's upsetting. But
no, I like hearing about other people's journey with this, because had it not been for my friend in Kansas that actually had a heart transplant, I would have been totally oblivious to all this. I am so thankful for him.
Oh. They
And
didn't prepare you very well, did they? I mean, they didn't have time, but afterwards they should have had education and to help you through that. And I hate that they didn't do that.
They was like cardiac rehab. I found out they was like, don't start until 8 weeks after.
Okay.
Don't call them, they'll call you.
Okay.
It was a cat and mouse game until 4.5 months after my surgery.
Oh, wow. Well, see, he was seeing his surgeon every 2 weeks.
They
had him in.
I seen 2 weeks and then 6 weeks, and then it was like bye-bye.
Oh my God. I can't imagine. See, he had to be followed for life with that. And you need to be too, because you had a heart condition. They need to follow and monitor.
Wait till the end of my story till we get to the last 3 weeks.
Oh boy.
Okay. So go ahead and share the last 3 weeks.
Besides the pain management, they cut me one. When I go back this next coming month, I will be cut back down to the 4 5s, which won't allow me to complete cardiac rehab. 2.5 weeks ago, my feet started swelling, went to my ankles, my calves, woke up, and I'm still a little puffy in my eyes. But now I'm dealing with heart failure. Keith didn't even know this.
Oh, honey, I'm sorry. They didn't put you on, like, there's 3 medicines that they told us that they put everybody that they say has congestive heart failure. And of course, after my husband's surgery, that was considered congestive heart failure because his heart was already enlarged. But they put him on potassium, they put him on a water pill, and they put him on, I think it was digoxin, which is a medication that makes your heart beat stronger. And he did fantastic on that. But without that medication, he would have really had a hard time back then, you know. And he did when we moved to Texas, but that's his story. But they need to follow you. They need to be taking good care of you.
So, yeah, I just came off of Lasix about a week ago. I seen that question, but we could probably be here in another hour if I was to go into how crappy both cardiologists I've seen are. The last time I was admitted was over New Year's. I found out my EKG at that time was not normal, and I was supposed to see a cardiac specialist. No one's ever told me, and I actually found it in my chart 4 days ago. So what I have done, I have basically fired everybody at this hospital. And I have an appointment August 23rd at OSU, which is one of the top hospitals, to see a cardiologist specialist.
Okay, good.
Because if not, I'm afraid that's why I wanted to tell my story, just in case something was to happen to me. So.
Yeah. It's scary, I know.
We're praying that it doesn't.
Yeah. Speak life, girlfriend. Speak life. Yeah, you're going to be okay.
I made it to 52 in May, so.
There you go. Well, we want you a lot longer than that. We want you a lot longer than that.
Yeah, a lot longer. A lot longer. Have you had any luck talking to your PCP saying, dude, none of this is happening? You know,
what was that, Keith?
Have you had any luck talking to your primary care saying, dude, I'm not getting XYZ?
He's the one that actually gave me my referral to up at OSU in Columbus.
Okay.
He won't carry me when I go to find a new doc. And that's because of me being dismissed because of Walgreens. He says he can't. He could, but I get it.
He just chooses not to.
Yeah. So
would it be something to go to the ER and I'm not a fan of going to ERs in general, but to possibly get a referral out of there and say, when they say go see your PCP, say, no, I need to see a cardiologist, you know. Well, go see the one. No, I need to see one, you know, and try to get a referral out that way, you know.
That's my primary care. He will give me any referral I want, at least. So I am lucky there.
Right.
It's just been.
I apologize for the camera moving, y'all, but I got to stand up for a little bit. I apologize for.
I know. I had to walk around too, so. Excuse me if I'm all over the place. That's why.
But so it's OSU, Ohio State, like the
University. Mm-hmm.
No offense.
One of the other problems I have that they found before the heart attack is I have calcium buildup in my aorta distended, which is below. My dad had an aneurysm there. My brother's was behind his heart, and I have. It's both of them's below 50, but I also have carotid arteries.
Wow.
And nobody's even checked them. Not done anything with that. So.
Girl, we got to find you some doctors in Ohio.
Oh, this has been.
You know, we need to see what we can do about finding some kind of advocacy group in Ohio. I don't know if it's like the Heart Association. I don't know who it is, you know, because there's so many different things going on. And I'm not a doctor, but it makes me sick and it breaks my heart because you're invisible, like all of us. And it's easier for them just to walk away. Then once
Hi, Cindy. I see you. My chosen sister just popped in here.
What's hard is when patients get very complex. Like my husband was very complex. Doctors tend to shy away from you.
Oh yeah.
Which is unfair, but they're afraid that something bad's going to happen while you're in their care. And I faced that a lot with my husband over the last 2 years. And it was a real struggle to get him the care that he needed. But on another note, check out healthgrades.com. You can search by state, by zip code, by practice. Like if you need a cardiologist, you would search cardiology in your location. They are rated by the patient experience. It's the patients that put the reviews in there. Google reviews is another one. But Healthgrades is how I found a lot of my doctors in Texas, except the one that won't medicate me appropriately. But there's just not a lot of good ones in my area.
Right.
So that's one. That's one thing you can do.
I may have found a good one, but I'll refer you to him. But he's going to be a drive for you. If he's 2 hours from me, he's going to be a drive for you.
Well, I used to drive to Oklahoma City, so I drove 5 hours one way and 5 hours another, all in one day, just to keep my pain management up. So it.
Yeah. Oh, I know. I mean, and the joke about Texans is it takes us that long to get to anywhere we need to get anyway. So we drive distances, crazy distances all the time.
Yes.
Just like I tell everybody, for me to get to Walmart is 30 minutes each way. Right. That's the closest Walmart. So, but yeah, check the website that Scissor Tail just gave you, because we got to get you some better care. If you're telling your PCP, if he knows you have these things, these carotid problems, and he's ignoring it, then we got to strike out and go somewhere else.
I'm hopeful once I get into this cardiologist specialist. With losing Dad to bone cancer, and we had a lot of the same symptoms. I've already been scanned, and I'm hoping when I see him on the 23rd, that through him, I will be able to or at least get the referrals from him on whatever else I may need to be. And I seen somebody that had asked about my lungs. My lungs are okay, although I do have a nodule they are keeping an eye on. But I got mold in my lungs on the job site 1 year, and I had a critical care lung doctor, so I already know what that's from.
Hey, Judy, you said you wanted to jump in here? Hang on, it says you're connecting, so give it a second. See if you'll accept it, because I added you to it. We're talking heart issues, but we're talking about everybody's issues here, y'all. So I think that's just who we are, y'all. That's who we are, So, Judy, what did you have to say?
Yeah, am I up? Oh, there I am. Hi. Hi, Tammy. We're neighbors almost. I'm about 2 hours.
I know. That was amazing when I found that out.
So, I have a doctor in Dayton. He's not A1 the best, but he's not bad for Ohio. A pain management doctor. If you contact me, I can give you some information. Also, I have my best friend is also a pain patient that lives over in the Hocking Hills area, which is kind of close to you. She has a decent doctor. Let me check into seeing who her doctor is and see if I can get some info. Maybe I can pass it along to you. I mean, OSU has a pretty good cardiac division. It's a teaching hospital, so as far as
my friend just had a heart transplant there about 6 weeks ago.
Yeah.
And
with
the
those
care
teaching
he
hospitals.
has gotten.
Yeah. Sticking with those teaching hospitals for these kind of things are probably about the best you can do. If it gets really rough, I also hear that Bethesda North in Cincinnati has a really good cardiac department now. Christ has always been really good. Of course, UC is always down there, but the problem with UC and some of those teaching hospitals is
I'm going to do this when you say that.
The nursing care sucks. Yeah, the nursing care sucks in those
Oh,
hospitals. They're so burnt out.
that's where I had my open heart.
So,
Yeah, my husband that passed away, he
so y'all
spent
two,
a lot of time at UC.
so
Sir?
Judy, you and Tammy like message each other. Like you need to follow each other so
Yeah,
you
we'll
can
do
message
that.
each other. So
Contact me,
you
and I'll
can
see what I can get together for you.
Okay, I
I'm going to be
appreciate
doing
it.
a lot of. I'll do it. I'm going to be doing a lot of traveling the next 2 weeks because all my long distance doctors are over these next 2 weeks. So I'm on the road a lot. Like I had to go to Indiana yesterday, but I'll see what I can get together. I'll see if I can get a hold of my friend and
Okay.
see what she's got. That's pretty. I mean, because Hocking Hills is what 45 minutes from you? Is that correct?
No, I know my daughter went to Hocking College. It's about 2 hours from me.
She's in South Bloomfield, and I know that she goes to Columbus a lot for a lot of her doctors.
Okay.
So,
I'm about an hour from Eastgate.
okay.
And then if I go the back way, I can be to Grove City in about an hour and 45 minutes or 2 hours to Columbus. So
Okay.
I'm kind of just
so
in the middle of nowhere. That's everything I got to drive.
Okay, I'm about 36 miles south of Dayton, or I'm sorry, west of Dayton. So I'm over by the border. So
Okay.
let's see what we can do to help.
yeah,
I just wanted to
You
jump
guys
up real quick to give you that information. So
that's one of the
nice
things
to
we're
meet
doing
you.
here.
It's
right?
nice to meet you too.
Thank you so much, Keith. Yeah,
no worries.
Thanks for the opportunity, Keith. Okay.
Oh, you're
Kick
very
me
welcome.
out.
Thank you for hanging out tonight. I will. I'll kick you out. Scissortail, do you want me to kick you
Love
out
you
too?
guys.
Yeah,
Thanks, Judy.
Good
Bye-bye.
to see you. It's nice to meet you, Tam.
right.
Thanks for having me
If I
up.
can figure out how
Oh,
to kick you out, I
anytime.
will.
Thank you.
Yeah. So,
I think I can kick myself out. Let me do that.
Can you? Okay.
Yeah.
There we go. All right. Not that I don't love you, Scissortail. You're great. Plus, you're like close. I want to ride your horse one day. So
You come and see me.
I have to be
I
nice.
apologize. I'm moving all over the place. I need to stand up and carry you with me. I'm starting to do the
same here.
wiggle.
The body tells us we got to move. The body tells us we got to move. So I think a lot of us have the same stuff. Again, we don't have the same diagnosis. We haven't had the heart surgery yet, but we've had doctors blow us off, right? We've had doctors, the medical professions, when they see us, it's like Scissortail was talking. If we have complicated issues, then we get pushed to the side. I said a long time ago in one of my videos that doctors, they want to. I use the fireman and the cat in the tree, right? A lot of doctors are like that. They want to be the fireman that rescues the cat from the tree by writing the script for cholesterol or for whatever. But when they present somebody, or somebody presents themselves and they have a list, they don't want to touch that because it's complicated and because they have to research, and it's not as easy as writing the script for whatever, right?
Right.
They have to do the work, and unfortunately, it's what we're up against, and in a lot of cases, everybody says you look fine, so they assume that there's nothing wrong. We don't have that other forearm coming out the forehead that they can see and touch, and they have to really figure things out. And you're right. It is because these doctors can, but they don't want to. And it's like they can help, but then they refuse. They just choose not to.
Yeah.
It's like the situation that you talked about at the very beginning about the nurse or the PA, whoever that went off. They changed at the drop of a hat. Well, it just they look for an excuse to say no, because it's so much easier to say no. And the way healthcare is right now, shortage of doctors, they know they got 10,000 people that'll take that appointment slot.
Exactly.
Right? And chances are, they've got allergies, or they have high blood pressure, or they have something simple that's easy to handle. Trying to see what else is going on. They drank the propaganda Kool-Aid. They do. And finances has a lot to do with it too, because they know they can make a lot of money doing other things.
Well, and that's, let me get back outside real quick here. I got my porch light on. And that was one of the things I kind of knew, like, with being gaslit so bad and everything, that I made an appointment with a therapist. And,
But see, even that's dangerous now.
Yeah.
Because they'll use that against us too.
You can only say so much. And that's like just being honest, like between the questionnaires and everything, if you know it's going to hurt you, don't put it down.
Right.
It's, I can't, like, and if by chance anybody has to have any kind of surgery, any kind of procedure, and I know Claudia and several others have spoke on this, make sure that prescription is called in, or that a family member or friend or somebody has it in hand.
Yeah.
Because if you wait till after, they're going to do everything they can not to give it to you.
Yeah, and I think that's what it is. You need to pick that up as you head to the hospital to be for your surgery, and because if not, they're going to do what they told you. I'll take care of you, and then you're not taking.
It's a lie. It's a lie.
And it's going to be a fight in a lot of hospitals because they're going to want to send you home with Tylenol, or they're going to want to send you home way under medicated because they don't want to write that script,
And it's like, even right now with me being from the 4 to 3, I can deal. I can manage.
Yeah.
And I'm grateful that he has done what he has so far. But it's like, I griped all those months, and, your house gets out of whack, your yard gets out of whack. And it's like, just because I'm not working, I still need to be able to function. And it just.
But see, Tammy, you bring up something that we all the pain patients, at least I feel, are dealing with. We feel grateful for crap.
Yeah.
Because it's something.
Mm-hmm.
Right? This quack I'm trying to leave, desperately trying to leave, and God, say prayers for this appointment I got tomorrow. So I can get all finalized. I'm grateful for the little bit of crap he does for me. Knowing that he could do so much more, but he refuses to. And he knows it. He knows I'm grateful for it. And that's a power trip. And we shouldn't be grateful, have to be grateful for bad care. And that's why we got to advocate. And that's why we got to speak out. And that's why we can't be invisible anymore. We got to be pain in the asses. We got to talk and share the stories like you did tonight. And like people are going to do next Thursday night. And then on and on and on. And get more vocal. All of us, we've all been so quiet. I've been quiet since 2016. And all it's done for me is like hurt the relationship I have with everybody. At least now we're all getting it out. You got your story out tonight. Somebody will get a chance next week. More and more people are getting their stories out. And, we may not get the answers we want, the ones we need, but at least we're not being quiet anymore. We're flying that flag going, hey, I'm here. Hey, I'm over here. I'm over here. So
I know I had posted pictures of the day after my surgery, and I took it down. And then I thought, no, I reposted, and I will warn everybody here: if you go and look at the pictures, they're quite graphic. It says warning, graphic content, but the first one is me holding my heart pillow. Yeah. And now I can look back, and even though I'm smiling, I can look at my own eyes. And it's like, I'm really amazed that I'm still here to be able to share this. And I just hope somewhere, it helps somebody, whether pain community or a family member or a friend that's just having regular surgery. Because I had a friend, her husband had some of his colon removed, and they sent him home on Tylenol. So it's just not us in the pain community. It's regular people that don't have the chronic pain issues that's being treated this way. And it's so heartbreaking.
It definitely is. So, awesome. How do you feel, Tammy? How do you feel right now? You're the guinea pig. You went first. Feel like you survived?
I will say, if you have the jitters or the nerves about doing this, don't worry about it, because once it starts, this is a lot easier than I thought it would be.
It's good for it. I think you think it was great. You know, we need to be vocal. You know, we need to be here. We need to let people know that we exist. You know, so I think you're beautiful. I hate this for you. You're a beautiful person. You're an important person. And for doctors to treat you like this, it breaks my heart. It breaks my heart. It really does. And as a community, y'all, we got to support our friends. You know, we got to let them know that they're valuable to us.
There's my lovely top of my zipper.
You know, that's crazy.
But
that's crazy.
I can still feel my wires here and down through here. So I'm waiting on that second opinion, and maybe have to do an update after a little while to see if I'm right about the first hospital screwing something up.
Right.
Hope I'm not, but.
So, all right. Well, y'all the best. Thank you for coming out for the very first one of these.
Oh, thanks for having me on, Keith. And thanks for everybody for joining in.
We got kind of started a little sideways. I didn't get the screen added right, but I think Mike gave Valerie the key to what I did wrong, and I apologize for that. We'll only get better, you know. Just having you guys out here to affirm both Tammy and myself that we're not alone in this ugliness. Though I want these lives to be an hour where you can just sit and know that you're seen and loved and appreciated. I know I didn't get through the comments tonight like I normally do, but I really was wanting to focus on Tammy and her story and ask questions when I needed to, you know, because like Tammy, like the rest of us, is all important, you know, matters. So unless y'all got any more questions, we're gonna wrap it tonight. Thank you for joining us, though. Y'all mean the world to me. I tell you guys that in every single video that I post, you know. Oh, somebody said, let's get holy cow, we're at 24.9. Oh, come on, y'all. Hit that tap that screen. Get me to 25. I don't know what'll happen, but, you know. Oh, we lost Tammy. There she is.
Back.
But my phone might blow up, you know, if we can get to 25. Oh, we got it. Okay. We can all go home and sleep well tonight. So you guys are the best. Tammy, thank you for your sharing tonight. You're a warrior. You're a trooper. You're it. Thank you. So thank y'all for joining us. And if you have any questions, message me. Let us know how my doctor. Trust me, there'll be a video probably posted before I leave the parking lot tomorrow to let you guys know how it went. So thank you for being here and for reminding all of us together that we're not alone. We're not fighting this by ourselves. All right.
And sending everybody a gentle Tam hug. And Tam means heart to heart. So
there you go. And send messages with questions if you have them.
Definitely.
And make sure you have Tam on your follow so you guys can get your information and everything shared too. All right. I love you guys. Please have a good night. I hope
Love
everybody's
y'all.
night's better than
Have a
last
good
night's.
night.
And we'll talk to you soon. See ya.
Hey,
Bye-bye.
see ya.